Hello again, we made it. Video number 3 of our Medicare 101 series. We're here. So if you missed the first 2, they're on our YouTube channel. They're also on our Facebook page. We went over the basics of Medicare, and the first one just a really quick rundown of what Medicare is. Video number 2, we got a little more detailed about the costs and coverage associated with original Medicare, Medicare Advantage plans, Medicare Supplements, and prescription drug plans, and how the plans work together, or if they work together. So that brings us to video number 3, Medicare sign-up period. So when do I sign up for these plans? How do I do it? So let's get into it. You ready? Okay. So if you are turning 65 and you are signing up for Medicare, you have what is called your initial enrollment period. So if you're turning 65, so during that period, you can sign up for A, B, or both. And it's the 3 months before, the month of your birthday, and then the 3 months after. So it totals a 7-month period. So it's the 3 months before you turn 65, the month you turn 65, and then the 3 months after you turn 65. That's your initial enrollment period. So how do you do it? You, for signing up for Medicare, you would contact Social Security Administration. So you can set up an online portal, do it that way, give them a call, schedule an appointment. But what we suggest is contacting us. We will help you through it. I think it's much easier that way. Initial enrollment period. All right, what if you are on disability and you're under 65? So your sign-up period is similar but a little different. So how that's gonna look is it's the 3 months before your 25th month of disability, and then your 3 months after. So it's still a 7-month period, but instead of that middle month being your birthday month, it's the month of your 25th month of disability. Does that make sense? Okay, so let me go back over that. So if you're on disability, you are eligible for Medicare, eligible to sign up for Medicare the 3 months before your 25th month of disability, then your 25th month of disability, and then the 3 months after the 25th month. So it's another 7-month period. Okay. What if you didn't take Medicare, you didn't sign up for it when you turned 65? You just didn't sign up for it for whatever reason. Now you're 67, 68, and you want to sign up for Medicare. When can you do that? That would be your general election period. And that's done at the beginning of the year. That is done from January 1st through March 31st. That's for A, B, or both. Again, that's your general election period. If this is after you've turned 65 and you didn't sign up when you turned 65. So it's A, B, or both. January 1st through March 31st. Your coverage wouldn't start until July 1st. And then right after that, from April 1st to June 30th, so right after that March 31st cutoff, then you can sign up for an MAPD plan or a PDP plan. So that's April 1st through June 30th. All right, well, what if you're leaving group? How do you sign up for group coverage? Or if you're leaving group, how do you sign up for Medicare? You have 8 months to sign up for A and B. 8 months after you leave group, that's a good amount of time. But you just have the first 2 months after you leave group to sign up for an MAPD or a PDP. Okay, so I want to get a little more into the MAPD sign-up periods because there are a little bit different ones, and then I'm going to go back to Medicare Supplements. At the end of the year, every year, we have what's called AEP. You have probably seen commercials about this because around that time, around beginning of October, they're on all the time. Humana, United Healthcare, Cigna, Aetna, they're everywhere. It's called the annual election period. During that time between October 15th and December 7th, you have the option to either sign up for a plan if you don't already have an MAPD or a prescription drug plan, or you can change your plan, or you can drop your plan and go back to original Medicare, or pick up a supplement. That's October 15th through December 7th. So that's the sign up period each year to change your plan or sign up if you haven't already, or to disenroll from a plan. And then at the beginning of the next year, January 1st through March 31st, we have another sign-up period. This is called the open enrollment period, and this just applies to the Medicare Advantage portion. You can switch plans. You have a one-time chance to switch plans. So let's say you signed up in October, but then you had to add a new doctor, or you have a different prescription now, and come January, things are looking a little different. Your plan doesn't cover like you thought it was going to. Things have changed. You now have a one-time chance to change your plan. Or you can disenroll and go back to original Medicare. Now, going back to Medicare Supplements, because I did run out of space on this board, you have a 6-month guaranteed issue period with your Medicare Supplements to where they do not do your underwriting. You are guaranteed to be accepted by your Medicare Supplement plan. They're not gonna look at your health history. It's just that 6 months when you turn 65, 6 months after. Now, there are other situations where you may move out of the area. Your Medicare Advantage plan might not be in the new area. We've had some weather-related special election periods where there's been some extreme weather, fire, flood, hurricane, tornado, things like that, where someone did not have the opportunity to change plans because of those extenuating circumstances. That election period, that sign-up period has been extended for them. And that just applies to even certain counties within a state, certain areas, and there are some more stipulations that go along with that. So there's other times when you might be eligible to change plans, but it's kind of a case-by-case basis. So it's really, I don't have a big enough board to put all that on because it is a lot of information. So I apologize if I skip something. That's why I always encourage you, give us a call. Now, like I said, with the Part A and B, you'd go through Social Security. With your Medicare Advantage plan, your prescription drug plan, or your Medicare Supplement, you would go through a licensed broker. Someone like us. Someone who is able to offer all the options for you and sit down with you and go over, what this has, and compare. We definitely recommend going with a broker because that person is going to be able to take a look at everything, a whole snapshot of what's available to you, all the different plans, all the different carriers, and really give you a good rundown after looking at your needs. So if you have questions, if there was something I wasn't very clear on, if you need more information on something, feel free to reach out. Again, my email address is lauren@dearretirement.com, and that's D-E-A-R. I think I'm gonna have to say that every time. D-E-A-R retirement.com. Like writing a letter, not the animal. Or you can give us a call on our 1-800 number. It's 1-800-615-1440. We would love to talk with you. We'd love to answer any questions that you have. That's what we're here for. We enjoy doing this. So again, if you have any questions, because I kind of went through this a little bit faster today because I didn't want to take up all your time, but we're here for you. Thanks for watching. And if you didn't catch the first 2 videos, go back and watch them. Thank you.